Welcome to Tuesday Tips with RN2 Professors. This video will review test-taking strategies for NCLEX questions and show you how to identify opposites in the options. Test-taking is a skill, whether you're a student currently enrolled in a nursing program or are preparing to take your boards. These tips will help you become more confident while taking an exam. When opposites appear in the options, they must be given serious consideration. Sometimes, a question will contain two options that are opposite of each other. They can be single words, or they can be statements that convey converse messages. One of them may be the correct answer, or they both can be eliminated from consideration. When options are opposite, more often than not, but not always, one of them is the correct answer. When one of the opposites is the correct answer, you are being asked to differentiate between two responses that incorporate extremes of a concept or principle. When an opposite is a distractor, it is attempting to divert your attention from the correct answer. However, this test-taking technique usually cannot be applied to options that reflect numerical values, such as heart rates, blood pressure, respiratory rates, and lab values. The following questions provide various examples of how opposites appear in the options. Here's our first example. In this question, options 1 and 4 are opposites. Examine these options first. They are contrary to each other in relation to before or after an event, which is getting out of bed. Now assess options 2 and 3. These options expect the nurse to apply anti-embolism stockings after a problem exists. The purpose of these stockings is to foster venous return, thereby preventing dependent edema. Options 2 and 3 can be omitted from further consideration. You have increased your chances of correctly answering the questions from 25 to 50%. Lower extremity edema can occur when the legs and feet are dependent. As a result, anti-embolism stockings should be applied before, not after, the client gets out of bed. In this example, options 2 and 4 are obscure opposites. Protein intake is related to the construction phase of metabolism, contributing to the repair and growth of the body, which is anabolism. Anabolism is the opposite of catabolism. Catabolism is related to the destructive phase of metabolism. This is when complex substances are reduced to simpler substances, releasing energy. Examine options 2 and 4 carefully because more often than not, an option that is opposite is the correct answer. That is your Tuesday tip. Check out the rest of my Tuesday tips on the playlist link or one of my many other NCLEX review videos. Don't forget to like, subscribe, and click the bell to get notified for more videos.